Hey everybody, welcome to today's lesson on patient consent in healthcare settings, in particular, informed consent. Informed consent is a critical legal and ethical concept in healthcare. The three types of consent in healthcare are informed consent, express consent, and implied consent. It is important that you understand the different types of consent, as consent protects patients and healthcare workers legally, ensures ethical integrity, and upholds the autonomy and dignity of your patients. We will discuss express and implied consent in a future lesson. Informed consent is the most regulated type of consent. For something to be considered informed consent, healthcare workers must educate patients about the risks, benefits, and alternatives of a given procedure or intervention. Informed consent is generally reserved for invasive treatments that have a higher risk of bleeding, infection, or complications. Anything that requires a scalpel will always require informed consent. Most exams that require a spinal needle, longer than 1.5 inches, also require informed consent. Informed consent requires the patient to be informed, to understand the information provided, and to voluntarily grant permission. It is extremely important that you understand all of the steps required to obtain informed consent. If any one step is missing, the informed consent is invalid. For something to be considered informed consent, there's a multi-step process involved. First, there's an information exchange, in which the healthcare provider informs the patient about the procedure in writing, including the risks, benefits, and alternative treatments. The healthcare provider may also provide a verbal explanation to the patient. Next, the healthcare provider confirms patient understanding. This can be done by asking the patient to state the procedure that is to be performed in their own words. The patient then voluntarily agrees to proceed. And finally, a formal document is signed. Remember, informed consent must always be documented for it to be valid. It's important to note that whichever healthcare worker is involved in the consent process is ultimately responsible for it. If there was an element missing, the healthcare worker involved in the consent process would be held liable. For example, a patient has been diagnosed with a cancerous tumor that requires surgical removal. The tumor is in a location that makes the surgery complex, involving risks of significant blood loss and damage to nearby organs. In order to obtain informed consent, the surgeon must provide detailed information about the procedure in language the patient understands, including the benefits and risks of tumor removal, as well as any alternative treatments. Then, the surgeon should allow the patient to ask questions and should address any concerns the patient may have. This is a two-way conversation to ensure the patient fully understands the situation. The patient should demonstrate an understanding of the procedure, the benefits, the risks, and the alternatives. A questionnaire or verbal communication is used to confirm patient and document comprehension. The patient must voluntarily agree to undergo the surgery. The healthcare provider must ensure that the patient is mentally competent, not under duress or influenced by external pressures. If the patient is not deemed mentally competent, their next of kin or power of attorney would be required to provide consent. If there is no next of kin or power of attorney, two doctors of differing specialties would need to consent for the patient. Reverting to two doctors providing consent is generally reserved for life-threatening issues or life-saving measures. For example, if a patient has a severe infection and has been deemed not mentally competent and requires a PICC line to administer life-saving antibiotics, two doctors from different specialties would provide consent in the event of no next of kin or power of attorney. However, for the most part, if a patient is deemed not mentally competent, every effort will be made to find a next of kin to act as the power of attorney for that patient. Finally, the patient or their legal guardian signs the informed consent document, which should be witnessed and recorded in the patient's medical records. Each step of obtaining informed consent is important, and together they create a comprehensive informed consent process that safeguards both the patient and healthcare provider. Again, if any step is missed, it is no longer considered informed consent. The importance of informed consent cannot be overstated. It serves as a safeguard against medical malpractice and unethical practices. Moreover, it empowers patients to make educated decisions about their healthcare. Let's look at a scenario together. A doctor and patient are meeting to discuss the patient's upcoming surgery and obtain informed consent. The doctor describes the procedure along with the risks and benefits. The patient explains the procedure back to the doctor in their own words to confirm understanding. The patient signs an informed consent document. Will this informed consent be considered valid? Take a second and try to figure it out on your own. This informed consent procedure is not valid. Although the doctor described the procedure, the patient confirmed understanding, and the consent was documented, the doctor failed to go over the risks, benefits, and alternative treatment options. Remember, every single component must be included every single time in order for the informed consent to be considered valid. In summary, there are 3 types of consent in healthcare: informed, express, and implied. Informed consent is the most regulated type of consent. Patients must be made aware of the risks, benefits, and alternatives associated with a procedure. In addition, the consent process must be documented and a patient's understanding of all information confirmed in order for the informed consent to be considered valid.